Hey parents, does your baby struggle to gain weight? No matter what you try, no matter how many different changes you're making to the diet formula, no matter how many different discussions with the pediatrician, is your little one still struggling to gain weight? Stick with the growth chart, and maybe they're stuck. Maybe they're falling back on that growth chart. And when that happens, the concern obviously, goes through the roof for both professionals and for parents, because we can start to be moving down the road towards a diagnosis of what's called failure to thrive. Now, those words are pretty heavy words because it's a serious situation that absolutely first and foremost needs to be checked out medically. 1 in 5 kiddos of failure to thrive have some underlying metabolic medical condition that needs to be taken care of in that incredible world. But if it's 1 out of 5, 20%, that means 80% of failure to thrive infants have no known identifiable medical cause to their struggles with weight gain, absorption, and getting on track developmentally. And so, for most families with failure to thrive infants, this video is going to be just super informative and helpful because it's going to give you those answers, and it's going to get into the root cause of what's really going on with their digestive system and what's really going on with their metabolic and their neurodevelopmental system as well. And what we'll do is we'll take this tough conversation, we'll take this tough condition, and we'll really get really nerdy and really intricate, but we're really going to get into a simple understanding of what's going on. We'll talk about the perfect storm pathway that many failure to thrive infants we're on during pregnancy, labor, and delivery, that they end up in this stressed out, struggling to gain weight state. And then, most importantly, we'll get into the answers and the action steps you can take that are drug free, that are natural and safe for your child to get their digestive system, to get their absorption, to get their nervous system and their weight gain back on track. We've been blessed in our clinic over the years to help tons of little ones struggling with not just some of the almost kind of pre-failure to thrive stuff like colic, constipation, and difficulty nursing. But when you take all of that together and the child is really struggling and you end up with this failure to thrive diagnosis, we've been blessed to sit knee to knee with so many families and dig in and partner up and get their kiddos to the other side of the struggle. One of them who still every week we get to see is a wellness kiddo named Knight. And Knight is just this beautiful, incredible boy who loves coming into Rising Health. But at first, Knight, he really struggled to thrive because he had such a hard time eating as a little one that they literally couldn't get any food with good substance, good nourishment, good proteins, good fats into his system. And also the reason that he struggled with, sensory and dietary aversions is because he was so stressed and his nervous system was so out of whack that when those foods did get into his system, it caused significant disruption and dysregulation. So, what happens, and this is a very important part of failure to thrive, is the brain and the nervous system, it learns. And so, for our little ones, their digestive system is still immature, has a lot of development to do, and their nervous system, which controls digestive motility, absorption, elimination, and function, it's also really immature and has a lot of development yet to do. All of that to say this, it means really this sensitive, even when it's working well, even when it's working normally for a child who is in that first year, 2, 3 years of life. And so, what happens during these sensitive, critical periods of development is our children, when they get stuck in what's called sympathetic, fight or flight, perfect storm, they get stuck there fast and they can get really far down the road and getting stuck in this sympathetic storm. And that was Knight. He had one of the most difficult times getting food in of perhaps any patient we have ever seen in our practice, until he got into the solutions and the actions we're going to share in this video, until we got his nervous system to relax and shift back into rest, relaxation, and most importantly, with failure to thrive, this word digestion mode. And so let's break down the science of how this really works and what is really creating the challenges that add up to failure to thrive. Well, number one, before we look at gut function, so whether a child is struggling with these sort of things, and it's very much as, absorption, nourishment, nutrition, a lot of times because our current medical system is so siloed and it's segmented and everybody has their own unique specialty, everybody looks in one little window and one little part of the body instead of looking at the whole, the part of the body that controls every other system, and that is the central and autonomic nervous system. The first thing that the nervous system controls in a developing infant is the muscles that latch, that swallow, chew, and bring food into the system. And then this autonomic nervous system, it's called the autonomic nervous system because all of that is supposed to happen on autopilot. It's really just programmed awesomely into the neurology of our babies so that they can find it. It's the breastfeed, bottle feed, it's the neural mechanics of swallowing, eating, latching. Well, then once that nourishment gets into the digestive system, there's something called the vagus nerve, and that rides along the esophagus into the digestive system and into the stomach and into the small intestines. And then there's this neurological, automatic control that moves the food through the digestive tract. And it's not just moving it all along to get it out of there, well, where it will eventually end up, in the diaper. But in that process, it's supposed to do two very important things that are completely under control of the autonomic nervous system. Number one, we're supposed to absorb the good foods. So we're supposed to absorb nutrients. And there's actually neurological programming and signaling from the brain to the digestive system through the vagus nerve and these sensory nerves that controls what that is. So move number one, absorption. Move number two is then assimilation. Now, that's a nerd word for organization. So getting the proteins, getting the fats, getting the macronutrients, getting the micronutrients, getting the minerals, getting everything into the baby's physiological system, and then sending it where it needs to go to create growth and weight gain. So what we really have to figure out with things like colic and failure to thrive is not just why their gut is shut down from a gastrointestinal, probiotic, digestive enzymes, nutritional standpoint, but we really need to investigate what's called neurogenic gastrointestinal issues. Now, neurogenic is a simple, nerdy word for saying the original stress is generated in the central and autonomic nervous system. And if that is thrown off track, especially if the nervous system is shifted and stuck into what's called sympathetic fight or flight nervous system, the very first thing the body does is preserve and conserve energy because the fight or flight response thinks that something big or bad is going to happen. So it actually shuts down digestive motility, absorption, and assimilation, and it readies the body for this protective response. So there's a saying by this famous cellular biologist, Dr. Bruce Lipton, that says you cannot be in growth, which is what we need to turn back on for our failure to thrive kiddos, for the failure to grow kiddos. You cannot be in growth and protection at the same time. So what we find every single time in our failure to thrive infants like Knight is that the nervous system, their sensory stress system, is stuck on. They are shifted into this sympathetic fight or flight dysregulation. Now, the last thing I want to teach you with this video is, well, what would cause that? What would trigger that? And it's really simple. It's what we call the perfect storm. The first trigger of this sympathetic fight or flight nervous system dysregulation in infants is a high stress pregnancy. In the literature, it's called maternal distress or maternal inflammation. And in today's world, a lot of times, moms are under a significant amount of stress, and unfortunately, medically, we don't support them. We don't empower them. We don't encourage them. The traditional medical approach to pregnancy is to diagnose the woman as pregnant and scare the heck out of her. Just to scare the heck out of her all the way through. And that's a whole nother conversation for another time, but it's something we're very passionate about, supporting and empowering and coming alongside moms and celebrating their pregnancy and addressing the stress on their nervous system ahead of time, because we know that's not only good for them, but that's actually gets us ahead of this sympathetic fight or flight inflammatory storm that the research and clinical experience now shows us that if there was a high stress, high anxiety, high tension pregnancy, if there was digestive challenges, if there was thyroid challenges for mom, well, then these metabolic, digestive, neurogenic challenges for baby can show up later on in life as well. And the second trigger within this quick little three-part perfect storm is the birth trauma, birth interventions like forceps and vacuum, emergency C-section, where we use either tools or a big set of hands to yank or grab a hold, yank and twist the child by their head and neck out of, and a lot of times these interventions are life-saving for mom and baby, but they're also life-altering for their vagus nerve, their autonomic and central nervous system. And the first place that birth intervention is going to show up in an infant's life, because the nerves that control swallowing, latching, tongue, and jaw function are coming out of the upper neck. So they're going to have difficulty, just like night, with the actual neurobiomechanical action of latching, swallowing, chewing, getting food into the system. So there might be a literal neuromechanical obstruction from what's called subluxation, from birth interventions at the very beginning of life. So that needs to get fixed first. And the second, that same area, when injured in birth trauma, it gets in the way of the vagus nerve, because the vagus nerve actually leaves and branches and goes down through the neck into the thorax and activates digestive motility, absorption, and assimilation. So what happens with a high stress pregnancy birth intervention is we're sending kiddos' nervous systems into this fight or flight response by shutting down their vagus nerve. The first thing that gets shut down is that digestion, that absorption, assimilation, and growth function. And the third challenge is when the nervous system is shut down and the gut is messed up, it's in a much more pro-inflammatory state. So yes, then we put dairy, then we put grains, then we put toxins into a child's already stressed and susceptible system. And we're going to have this inflammatory cascade, but generally the inflammatory component of digestive distress in infants comes as a third trigger, not the first. So what we've been talking about all along is the fact that the real underpinnings of failure to thrive is a central and autonomic nervous system that is stuck in sympathetic fight or flight overdrive. And once it gets shifted into a sympathetic fight or flight overdrive, that's the same thing as saying the parasympathetic rest, digest, growth, and development side of the nervous system is shut down. So if you've heard about the gut-brain connection, it's absolutely real. It's absolutely true, and it's done by the vagus nerve and the autonomic nervous system. And that vagus nerve is so sensitive to emotional stress during the development and prenatal periods, and it's so sensitive to the physical stress from birth trauma and injuries to the neck from forceps, to vacuum, emergency C-section, breech position, cord wrapped. And it's also very sensitive to the inflammation and toxins and those things as well. So what that all adds up, and what I want to show you just visually, is a case like Knight's. We actually measure and quantify this neurological, neurogenic, sympathetic dominance, and overall what we would call exhaustion. Because what happens with failure to thrive is after that little one's nervous system fights so hard and gets so stressed for so long, it eventually just runs out of gas and becomes exhausted. So what we're looking at here is an HRV, heart rate variability, which is just a global autonomic vagus nerve stress test. And we're looking at it for one of our little kids who was failure to thrive. And all you need to see with this is that the white dot right here, really low on this chart, so right here, the green here, green is good, green is resilient, green is adaptable, green is where the nervous system and the digestive system would be able to control motility, control and have optimal absorption and assimilation and growth generated. But what we see here is on this autonomic activity index, when a child's nervous system gets stressed out really early, real often, and it gets really exhausted, and so a low functioning heart rate variability, or HRV, is a sign of low vagus nerve parasympathetic responsiveness. So that side of the nervous system can't It just can't do its job. And I just wanted to not only talk about this the whole time, but even show that HRV, because here's the deal. I bet you are trying, you know, just incredibly hard as a brand new parent to get that good nutrition in. You're trying to supplement. You're trying to maybe fortify things to get your child to gain weight and get back on track. But even if you're putting all the right stuff in, it can't get in. It get absorbed, get used. If your child's nervous system is sympathetic dominant and neurologically exhausted. So the final thing I'd encourage you to do with this, I know super nerdy, but also we've kept it super simple and straightforward video, is you need help. This is the job of a neurologically focused pediatric chiropractor. We are the only ones out there in healthcare who understand this perfect storm pathway of how these early and often stressors can take the child's central and autonomic nervous system at a total foundational level and shift it into sympathetic dominance, which then shuts down the gut and everything we've been talking about in this video. But here's the most important thing. It's one thing to know about, it's one thing to find it, like these HRV and another scan we use in our office called the thermal scan. You've got to get those scans for your kiddo. You need more information on this because it's one thing to find, it's a whole nother thing to fix. And so the last thing I want to share in this video is, when I say fix it, I don't mean that chiropractic, this nervous system focused pediatric chiropractic. We don't look to cure colic, failure to thrive, chronic ear infections. There is no cure. There's no diagnosis in the way that we work. That's not that's the business of medicine, not chiropractic. What we do is we address the real root cause. We don't cure, we take care of the root cause and we address it head on. The coolest thing about the techniques, the safe, gentle, you're gonna watch your baby get adjusted, and you're gonna go, that's it, that's all it is, because they are wound up, stressed out, stuck in fight or flight, not gaining weight. Just a little one that needs the safest, gentlest, easiest adjustments to put their nervous system back into parasympathetic. We know exactly how to stimulate and activate the vagus nerve and the parasympathetic system. It's a very special set of training and experience and techniques that not all chiropractors at all know how to do. And that's okay, because other chiropractors are trained more in traditional neck pain, back pain, that sort of stuff. But the doctors at Rising Health not only know this science and these clinical protocols and use this technology, but we're trained in the exact right, safe, gentle, effective techniques to shift your child into parasympathetic function, which is growth, digestion, regulation, absorption, assimilation, and development. And when you activate that parasympathetic vagus nerve system, you finally get to shut down the sympathetic fight or flight, stuck or overdrive nervous system that we've been talking about all the time. And probiotics, they don't quite get in there. Digestive enzymes don't quite get in there. Formula changes don't quite get in there and access the nervous system like a neurologically focused pediatric chiropractor, just like at Rising Health. So what I want you to do is send us a DM or a comment below if you feel you need more resources, more education, more explanation of how this all works. We'll have all the links below. But if you are ready to get your little one off this failure to thrive, stuck, stressful point and back into growth and developmental neurologically, ready for a deep dive consultation, get into the scans and examination, and most importantly, get your child these neurologically focused parasympathetic vagus nerve activating adjustments to turn that growth mode back on and get them back on track, weight gain, developmentally, neurologically, and get scheduled today. If you found this video helpful and you know another family who's struggling with this or something like it, please also share and send that along. Thank you all very much, and we'll see you in the next one. God bless.